Welcome to the session titled The Mental Wellness of Citizens of the Métis Nation of Ontario Before and During COVID-19, a Mixed Methods Study. Thank you again for joining us today. During this session, we will highlight work that has been led by the Métis Nation of Ontario, or MNO, and supported by ICES. This work demonstrates how mixed methods can conceptually and analytically integrate qualitative research with quantitative methods of research to facilitate knowledge translation. First, a few housekeeping items. A reminder that the sessions are live and being recorded. Video recordings will be available 24 hours after the conference. And for this session only, the chat has been disabled. We encourage you to share your questions and comments in the Q&A section. We will address them after the presentations. Next slide. Thank you. My name is Sujitha Ratnasingham. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. I live in Toronto with my husband and 2 sons. We are settlers to this land. My ancestry is in South Asia. As such, I want to acknowledge the land I am on as a traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and Wendat peoples. It is also home to many First Nations, Inuit, and Métis peoples. This land is covered by Treaty 13 with the Mississaugas of the Credit. We are thankful to be able to work and live in these territories. We are thankful to the First Nations, Inuit, and Métis peoples who have cared for these territories since time immemorial and who continue to contribute to the strength of Ontario and to all communities across the province. I also recognize the many ways by which my family and I have benefited from the ongoing colonization of this land and our responsibility to reconciliation with the First Peoples. At ICS, I'm the Director of Strategic Partnerships and the Interim Director of the Indigenous Partnerships Data and Analytics Department. Next slide, please. Before we get into the session, I want to briefly discuss the partnership between the Métis Nation of Ontario and ICS that has made this work possible. ICS and MNO formalized a relationship with the signing of the Data Governance and Data Sharing Agreement in July 2016. In this picture, you can see President Fro and Dr. Michael Schul, ICS's CEO, signing this agreement. This partnership has grown and matured in the years since, with a focus on integrating data held at ICS with Métis data and mutual capacity building, including the secondment of staff, 2 of whom you will hear from today. With that, I have the pleasure of introducing our speakers. Next slide, please. Tara Beaulieu is a citizen of the Métis Nation of Ontario with ancestral roots from the Métis communities of St. Laurent, Manitoba, and Qu'Appelle, Saskatchewan. She's the founder and director of the Weaving Wellness Centre, a private clinical and consulting practice specializing in serving Indigenous peoples and communities. She holds a PhD in counseling and clinical psychology from the University of Toronto and currently practices as a registered psychotherapist in Ontario. Next, we have Abigail Sims, who is a citizen of the Métis Nation of Ontario and a descendant of the Mattawa-Ottawa River Métis community from the Stoquois line. She's an epidemiologist working for ICS and seconded to the Métis Nation of Ontario. Her work focuses on Métis health and wellness research. Abigail completed her undergraduate degree at McMaster University and her Master's of Public Health at the University of Toronto. She's passionate about the health and well-being of her community and is grateful to use her education to address the needs of MNO citizens. In her spare time, she enjoys time in nature and reading. And finally, we have Sarah Edwards, who is a public health epidemiologist and health services researcher, with more than a decade of working at the intersection of public health practice, applied research, and knowledge translation within the health system across Canada. She holds a PhD in epidemiology from the Dalla Lana School of Public Health at the University of Toronto. In her current role as an ICS staff scientist, she is seconded to the Métis Nation of Ontario and supports Métis-driven research. I'll now turn it over to Dr. Tara Beaulieu. Next slide, please.
Good morning. Thank you so much for that lovely introduction. It's wonderful to be here, and I'm really delighted to be co-presenting with my colleagues, Abigail and Sarah, and just an acknowledgement to the rest of our collaborating team to speak to the results, the preliminary results of our mixed method study exploring the mental wellness of citizens of the Métis Nation of Ontario. Next slide. As many of us know, I mean, we all lived through the COVID-19 pandemic, which caused, significant disruption. And for Indigenous people and for Métis people specifically, so much of our well-being is actually interrelated to connection, to interrelationship, and to community. And so the social disruptions that came about as a result of COVID-19 significantly impacted mental health and wellness for all people, but particularly for Indigenous and Métis people specifically. And although, this is really widely understood and accepted, the Métis specific story of health and wellness and mental health, particularly around the outcomes during the COVID-19, is missing or was missing, in addition to many other pieces of work and research related to health and wellness for Métis people. And so our project in particular was designed to try to fill this gap in knowledge within an Ontario context and for Métis citizens in Ontario. Next slide. And so just a little bit of background around who Métis people are. Best people around, I have to say. I mean, I'm biased, but just so that everybody is sort of on the same page in context. Métis folks, our communities, they evolved and emerged as a result of early intermarriages between First Nations and European fur traders. And it's a really common misconception that Métis people are simply a mix of or a little bit Indigenous or not fully Indigenous as themselves, as a Métis person. And those early intermarriages, it's after multiple generations of those marriages where we see Indigenous people, Métis people start to come together. Developing their own cultures, their own practices, their own language, and historical narratives that are connected to land and place across the Métis Nation homeland. It's that multiple generation and ethnogenesis over many years, where we see the emergence of a distinct people known as the Métis. And so the Métis formed distinct communities in parts of Ontario, across the prairies, British Columbia, the Northwest Territories, and into the northern United States, which is commonly recognized as the Métis Nation homeland by the Métis National Council. And again, Métis people are amazing, beautiful, wonderful, rich culture and community and nation of folks who are known by many names, and many names that have been given to us by other Indigenous people, but that we also use to refer to ourselves. Next slide. And so in 1993, the Métis Nation of Ontario was established, the will of Métis people and Métis communities coming together throughout Ontario to create a Métis-specific governance structure. Today, the MNO has built a province-wide structure, which includes the only centralized registry of Métis citizens in Ontario, approximately 30 chartered community councils across the province, which represent Métis citizens at the local level, and a provincial governing body that is elected every 4 years. We're also in the middle of an election. In addition, the MNO delivers programs and services to its citizens through more than 30 locations across the province. And I also just wanted to take a moment to acknowledge any of our elected leadership, including President Margaret Frow, who has joined us for today's presentation, our Métis citizens, and our secretariat who do the work day in and day out of the Métis Nation of Ontario. So with those acknowledgements and thanks, I'll now pass the presentation to Abigail to speak about the qualitative component of the project. Marcy.
Thank you, Tara, so much for that lovely introduction to the project, and to Sujitha to the context of how this work came about. So For the qualitative portion of this project, the objective was to explore the mental health and wellness experiences of MNO citizens, both before and during the COVID-19 pandemic, using qualitative and Indigenous methods. Next slide, please. So looking at the methods, for the design of this study, we chose to go with both the option of participants sharing their COVID-19 mental health journey either through a sharing circle or an interview. So whenever folks were screened into this part of the project, they were given the option to either join a sharing circle, and they were specific, either like women's, or if you participated in like mental health program through the MNO, you could choose this type of circle you wanted to participate in, or an interview. And we really just wanted to respect people's preferences for sharing their mental health and wellness story, seeing as it can be a very difficult topic to talk about. And some folks prefer doing that with others, and then some folks prefer doing that by themselves. So in the end, we ended up with 3 sharing circles, averaging a time of 120 minutes, and 26 interviews, which averaged a time of 37 minutes. And for each sharing circle and interview, we had a Métis facilitator and a Métis registered psychotherapist present, which was really excellent, so that we were able to really support the mental health and wellness of participants during their conversations with us. So the interviews and sharing circles were all done virtually and were recorded on Zoom. They were then transcribed verbatim and shared with participants for verification. And prior to that verification, they were also anonymized. And for verification, it's simply just sending the transcript back to the participant and asking them to review it, to add or take away anything that they want from the transcript, or simply give it a thumbs up and say that it's ready to go for analysis. So next slide, please. So the analysis is ongoing. So we're really just presenting preliminary results specifically for this portion of the project. For the analysis, we took an inductive thematic coding approach to the transcripts. And one of the early steps of analysis for this type of work is to create a code book, which we created through a process of open coding and revision through discussion between coders and the larger group. So the initial codes were generated from 4 transcripts and then applied to a larger sample. So coders, myself and my colleague Noelle, met regularly to discuss the application of the codebook and to add and or adjust the codebook, which is something that we're still doing. We are going to be hopefully applying all the codes soon to all of the transcripts, and then we'll be meeting with our larger group of collaborators to discuss how our interpretations align or diverge, and what changes still need to be made to the codebook, and refine that with our coding. Thank you. Next slide. So the slide is just a summary of the codebook that we're working with, and some of the major codes or themes that we're seeing in the left-hand category are COVID-19 induced changes to systems and services, some codes around death and dying, emotional experiencing, interconnectedness, which Tara mentioned in her introduction, how important it is to Métis people, Métis wellness, and wellness within the family and kin network. So for Métis wellness, we've divided it into sub-themes of cultural wellness, emotional health, mental health, physical health, and spiritual health. But it's also very important to recognize that all these things are very much interconnected. And so there are overlaps between the different codes that are kind of hard to keep separate. So next slide, please. So for some high-level preliminary results, which I'll be presenting over the next 2 slides, we found that overall the COVID-19 pandemic was disruptive to many aspects of Métis citizens' daily lives. I don't think this is surprising for anyone. I think a lot of people found that their lives were significantly disrupted because of COVID-19. This disruption affected traditional Métis and Western health and social systems. So for traditional Métis health and social systems, a big component of our health is community and being able to connect, and that was very difficult given that we weren't allowed to spend time in person. And then a lot of disruption happened for folks who practice ceremony, to support their health and their spirituality. So folks weren't able to necessarily gather for certain ceremonies that typically happen in a group, though there were a lot of creative ways to troubleshoot this with virtual approaches. And then for Western health and social system disruptions, folks shared with us that they were having delays to medical appointments, that they felt worsened their condition and then their quality of life. And then there were delays in the justice system that were shared with us around adoption specifically, and how that really delayed the process of adoption. So for participants' mental health journeys, they followed different paths and could be influenced by their mental health prior to the pandemic, pre-existing mental illness, and mental unwellness and substance use, and also the way folks perceived their personalities. So some folks felt that they fared better because they were more introverted and could handle the isolation more so than folks who were maybe more extroverted and really needed that in-person social connection to support their wellness. Next slide, please. So for preliminary results, continued. This is kind of the silver lining slide. So a couple of things that participants shared with us that were positive in their view were that some services, community events specifically held by the MNO and community councils, and education became more accessible because of the shift to an online environment. So because we couldn't meet in person, a lot of things ended up happening in our own homes. And for some, that was a big plus. And then additionally, the new slower pace that the COVID pandemic forced onto a lot of people was also a positive aspect for some who described the prior world in non-COVID times as being very much a grind mindset. So they appreciated COVID slowing everything down. Next slide, please. So the next couple of slides are some examples of participant quotes that speak to a couple of the codes in the codebook I talked about previously. So this one is from a participant of one of the interviews, and they speak to codes of isolation and grief happening on a couple of levels. So they mention folks were passing away and there was no closure, so it was really hard to grieve, which is something that came up quite often. So some folks found that, if they had a loved one pass away, they couldn't hold a funeral. And if they couldn't hold a funeral, so it was really hard to grieve that individual. And then there was also delays just in being able to bury them and to be able to get a headstone and things like that. And then also grieving the world that used to be prior to COVID-19. So this participant uses language of being untethered and feeling like they were floating and not recognizing the new universe that they're living in because of the changes brought on by the pandemic. So this kind of speaks to a few of the codes that we found are interpreted from the transcripts. So the next slide, please. So this quote is from an individual who participated in the Women Sharing Circle, and they're speaking to the positive aspects that influenced their life brought on by the pandemic. So this person was able to go back to school. There was a lot more funding for students, so their financial situation turned around. They were able to access online appointments for healthcare and social programs, and also community events put on by the MNO. So they described this as a life-changing experience. Next slide, please. And to conclude with some high-level observations, the disruptions caused by the COVID-19 pandemic had both negative and positive impacts on the lives of MNO citizens we spoke with. Technology also played an important role in keeping families and community members connected with one another, though in-person socializing is still preferred for most. Technology also played a big role in creating a more accessible world for some folks in terms of access to healthcare, social systems, connecting with the community, and education. So thank you very much, and I'll pass it on to Sarah.
Thank you, Abby. So if we move, yeah, great. I've already moved to the next slide. So I have the opportunity to present the quantitative component of our study, And the objective for this part was to examine changes in patterns of mental health and addictions related outpatient health service utilization using population-based data on MNO citizens before and during the COVID-19 pandemic. So Sujitha already mentioned the enabler for us to be able to do studies like this is the data governance and sharing agreement that the MNO has with ICES. So if we move to the next slide, please. I know many of you may be very familiar with ICES data who are joining our particular session, but I just wanted to highlight the ICES data holdings, which is quite unique. So the ICES data repository consists of record level data that are coded and linkable, and encompasses administrative health data sets or the publicly funded health service utilization of the more than 13 million people accessing healthcare services and living in Ontario. Currently, the repository includes I think it's hundreds of data sets, and we are using a small number of them for the purposes of this study. But the relationship between MNO and ICS enables the Métis government here in Ontario to access data on their citizens to inform programs and services and advocacy on behalf of citizens. So if we move to the next slide, please. So this is just some of our methods that we use for our quantitative component. So what we did was calculate monthly rates of the mental health and addiction outpatient visits. And the outpatient visits were physician claims database for insured services. So this would include outpatient visits to family physicians, to pediatricians, as well as psychiatrists that are all funded by the Government of Ontario, and the visits were all related to mental health and addiction services. And we compared these monthly rates between the pre-COVID period, which we defined as being March 2017 through February 2020, and the post-COVID-19 period onset, which we used March 2020 through December 2022 data, which was the most recent data set available when we were completing our analyses. We ended up comparing rate ratios between the observed and expected rates, and they were derived using the Poisson generalized estimating equations. And we were also able to stratify the data and examine these rates by age and sex, which are the two variables that we have available to us in administrative health data. So if we move to the next slide, please. To start, this is just a description of the entire cohort that we were able to link. So the MNO registry data was current as of November 2022 for this linkage study, and we were able to link 28,400 MNO citizens. You can see some of the basic descriptions of the overall cohort here. We had approximately equal numbers of men and women in the cohort. We had just over half in the middle age group between 30 and 64 years. And when we used some of the Statistics Canada definitions for urban versus rural, we saw that just over 2/3 of MNO citizens were living in urban areas and about 1/3 were in rural areas. If we move to the next slide, please. So I'll just orient the audience to our figure here. So if you take a look at the line in the middle, that's where we designate sort of the pre-COVID versus post-COVID period. So it's the black line in the center of March 1st, 2020. If you look at the blue line, that is the expected number of visits, and the red line is the observed number of visits. And so if we use the pre-COVID period to project out the expected number of visits, you'll see that in the blue line. What we see with the actual observed number of visits is that there is an increase. So what we saw was a 13% increase in the number of mental health and addiction related visits over and above the expected number for MNO citizens in the post-COVID-19 onset period. And this was statistically significant increase in MNO citizens visiting their primary care physicians, pediatricians, or psychiatrists. If we can move to the next slide, please. We also saw when we were able to stratify the data that we saw a larger number of visits, or more women visiting for mental health and addictions related reasons compared to men. And we also saw, very interestingly, which I think is in contrast to some of the mainstream data, a high number of visits in those in our oldest age group, so age 65 and older. The rates were higher than expected, particularly in this age group. So if we move to the next slide, please. What we can see from our data is that MNO citizens, and in particular women and citizens who were 65 years and older, experienced an increase in mental health and addiction outpatient visits in the period post-COVID-19 onset that persisted up until at least December 2022. And we know, as Tara alluded to in our introduction, that there is a gap in research specific to Métis people. And so this sort of high quality and contemporary data on mental health outcomes for Métis people is crucial to inform the allocation of very scarce mental health resources. So the MNO does run its own mental health related programs and services. And this sort of data to inform that and to make the rationale to continue that is really crucial. So we have this information, and this is one of the first of its kind studies to use this type of data to demonstrate what is happening for Métis citizens. And we're going to be able to use this data in an ongoing way to continue to inform programs and services that the MNO runs. So if we move to the next slide, please. So we have a number of acknowledgements. No study is done on its own, so we certainly have a team of people. First and foremost, we want to acknowledge the MNO citizens who shared their stories as part of this research. Without them, this would not be possible. We also had 2 MNO senators who joined this study and participated alongside our research team in the sharing circles. To make sure that the sharing circle started and ended in a good way. So we'd like to thank Senator Pearl Gabona and Senator Ron LePage for their participation in this study. We also would like to acknowledge that the study was supported by the Canadian Institutes of Health Research. So this was part of an Indigenous specific call during the COVID-19 period. So we competed in that and were funded. And then, of course, the Métis Nation of Ontario for in-kind funding for investing in positions like the one Abigail and I share, and our colleague Noelle. So this sort of work can be done, as well as ICES for having the incredible infrastructure to be able to support this sort of work. So if we move to the next slide. Our last thank you is to the audience for coming and listening to this work. And we're happy to take any questions that you have and hear any comments you have.
Thanks so much to the 3 of you for such a great presentation and for walking us through, the understanding Métis perspectives and culture through to the qualitative piece of the project and the quantitative. Maybe I'll start with a question to give people an opportunity to reflect. With any research study, there are limitations, sometimes related to the data and sometimes related to methods. Are there any limitations that you feel were there for this study? And if so, are there ways that you've identified to try to address them in future similar studies?
I could start. As with any administrative health study, we're limited in the number of variables that we can explore in terms of experiences for MNO citizens. So we have age and sex, and we're able to look at the areas that people live in, so that urban-rural divide, as the example that we presented here, but we don't have other really important determinants of health like income and education. And those sorts of things would be amazing to explore. We do have those through population-based health surveys that the MNO runs, but that is, of course, a sample rather than the entire population like we're able to do with the administrative health data linkage. So for sure, that is one of our limitations with this data.
I can speak to the qualitative portion. Yeah, so for the initial study design for this portion of the project, we were looking to do more sharing circles than interviews. And so we did have a little bit of difficulty recruiting for our sharing circles. But as I think I mentioned in the presentation, I think it was there was difficulty there because of people's feelings around mental health and wellness during the COVID-19 pandemic and wanting maybe more privacy to talk about those stories. We also wanted to have like more specific sharing circles. So we ended up having 2 women's sharing circles and 1 2S LGBTQ plus circle, which is great. But we did want to also have ones around like folks who use the justice program and specifically mental health and wellness. And we weren't able to recruit enough folks for those ones. So I think for future projects, maybe trying to partner more closely with like the MNO programs to try to recruit, even though we did try that. I also think that part of the difficulty around that was we were doing this data recruitment, I believe in 2021, so early on. So we're still very much in COVID, and I think a lot of people were quite tired. And so I think being able to recruit folks to come and talk to us for up to like a couple hours if you're in the sharing circle, or like an hour if you're just coming for the interview, could be a little bit much to ask. So I think it was a combination of the timing and the subject matter that were a bit of a limitation for this one.
Thanks so much. I had a couple of questions. Oh, sorry, go ahead.
Right, I'll just mention one other limitation with the quantitative data, and my co-presenter Tara will know this very well, in that many of the mental health and addiction related services are outside of the publicly funded healthcare system. So we are only able to look at that very narrow piece. So for sure, there are many other services that are not captured as part of administrative health data in the mental health space.
Absolutely. I think we have a lot of data at ICS, but there are definitely some areas where it is limited. We had a few questions come in, so I think this one probably is for you, Sarah. As part of your quantitative work, did you look at prescription drug use related to treating mental health? The thought would be MNO people using other coping strategies when they may not have been able to have community support.
That's really interesting. We did not look at prescription drugs as one of our. We have. This is preliminary analysis, as my colleagues have said, but we did look at hospitalizations as well, but we've not looked at prescription data. But very interesting idea.
I don't know, Tara or Abby, if you wanted to add anything to that.
No, I don't.
I mean, the one thing that I would say, I think, and I participated in some of the sharing circles. I think in some instances, there was, because everything went virtual and online, there were more opportunities for people to actually access virtual-based cultural programming. So beading circles or visiting circles or talking circles. And so in some ways, I think some Métis folks actually leaned a little bit more into a cultural sort of culture as coping, because there were more things that just kind of opened up in online spaces, which was, especially for folks in rural or northern communities, is not always possible to travel to. So even myself, we facilitated a number of wellness-based sessions throughout, the height of the pandemic that were really culturally founded, and we had regular and consistent engagement. So just to acknowledge too, I think there are, when we talk about coping or taking care, many Métis people turn to their culture for that kind of support as well.
That's a really helpful point, because that's the one. Oh, sorry, go ahead, Abby.
Oh, sorry. I just wanted to add on to Tara's. That's something that we also saw in the interviews. So I was the main facilitator for those. So a lot of folks were talking about turning into culture. One, because I felt some of folks had more time. Like, I think there were like a lot of trends that were happening, like in mainstream culture, where people were like suddenly into sourdough or suddenly into this or that because they had more times on their hand and were looking for something to cope. So some folks turned to culture. A lot of people talked about learning how to bead or exploring spirituality maybe for the first time, or learning more about their ancestors or language. And a lot of that happened through things that were accessible at the time. So yeah, the virtual sessions, especially the ones for like beading or crafting workshops where folks like had things delivered to their door and it was like as accessible as you probably could make it, were ones that were talked about a lot and really highly valued for maintaining wellness during the pandemic.
Thanks so much, Abby and Tara. I think that's really helpful context around some things that did improve in terms of accessibility during that time. So another question came in. So really interesting presentation. So thanks to all of you. So the first question is, did you investigate, so this might be for you, Sarah, to start as well. Did you investigate whether the visits were new clients, i.e. hadn't seen access to mental health outpatient care in the past versus those who are continuing visits? I think that was related to the mental health visit slide.
Yes. Yeah. And this is a really interesting question. So there is a mechanism for us determining that people have used the mental health and addictions related services or outpatient visits before. And it was all integrated in terms of the algorithm that we were using, but we didn't stratify by that, for example, looking at new versus previous. We took it as a whole, right?
Okay.
Yeah, so that's...
Is that partially like sometimes with sizes of populations, it gets challenging to stratify into smaller and smaller groups? Or just that wasn't a part of the question?
Yeah, it just wasn't part of the question that we had defined. But yeah, I mean, that is a good point. We do often run into sample size limitations, given the MNO citizen population overall is close to 30,000. But in this case, because we were looking at visits, we didn't run into any kind of limitations on that we were able to stratify. We just didn't look at that particular one. I can take it back to our team.
Can I make a comment on this? I'd love to make a comment if I can. You know, I think there's something that needs to be said around culturally safe spaces for Métis people around health and wellness, and whether mainstream hospitals are actually culturally safe for Métis people to access. And what does that mean? So when we talk, because, you know, this is something that we often are talking about, you know, how do we increase cultural safety for Indigenous people in healthcare spaces? And I'm just wrapping up a project on anti-Indigenous racism in the healthcare system. And so I think we need to really reflect on, and this is, I can tell you as somebody who's worked a lot in the hospital system and who is Métis, that many of those spaces are not 100% not Métis specific. And if there is programming that does create space for Indigenous people, so if we have a pan-Indigenous, you know, mental health program, for example, or a mainstream program that has some connection to an Indigenous program elsewhere in the hospital, that a lot of the time Métis specificity is not attended to. And so I think this question is an important one, but I think we actually need to even take a step back to understand, you know, what Métis people's experiences are around accessing healthcare spaces. And if if numbers are too low, even to be able to do that sort of analysis, why is that? What's happening? Because my assumption, I mean, this is probably my bias, but there's likely a lot of outpatient care that Métis folks do access and might actually be, you know, community-based access, for example, as first line intervention. And so I just wanted to name that as an important factor here for when we start to talk about engagement in accessing mental health, you know, treatment programming or ER visits or things like that, because that's a really important determining factor for whether or not we see Métis people access those spaces at all.
It's a really important piece of context to consider the system level barriers that might be preventing people from getting the care that they need. Abby, did you want to add something?
Yeah, for sure. So I just wanted to comment on during our conversations with some folks in interviews, and I imagine in sharing circles, some individuals shared kind of like the mental health diagnoses or struggles that they were dealing with both before and during the pandemic. And some folks did share that they received like new diagnoses for like anxiety or depression or something like that, and or experiencing a worsening of symptoms of something that they were already dealing with. There was also a lot of folks who shared that they had accessed the M&O mental health and addiction services and found that those were a really positive influence on their mental health because they were able to connect at least with like an Indigenous psychotherapist or mental health professional. And so that was really positive for them. So there was a lot of praise around that program specifically, and also being able to connect folks because that's like a gateway, right? So if someone was struggling with like addiction, then they would be able to like possibly go to like the iStop program or some other type of program to help with that part of their wellness. So those were that's like a couple of themes that we have in our code book right now, but those were definitely like two things that were talked about a lot.
Thanks so much, Abby. I think demonstrating why the mixed methods approach provides so much more context than just doing a quantitative approach. We have a question about the sharing circles. So in terms of the sharing circles, was there anything that really stood out to you or something that you were surprised by?
Tara, do you want to take that one or do you want me to?
Oh, sorry.
I will go. I feel like it wasn't necessarily that surprising. It was kind of more like, at least from my experience of having going through the pandemic as someone who is Métis and M&O citizen, and knowing that I was really into beading a lot. That was a huge part of maintaining my mental health and wellness. I think for me, what was surprising, mainly probably because I don't have children, was the number of folks who shared that they had to find significant mental health supports for young kids, as young as the age of 5, who were having some really complex mental health issues and really struggling with isolation of the pandemic. And I guess there were folks like grandparents who were reflecting on how much difficulty young people were having socializing post-pandemic. So that was maybe surprising for me because I'm just at a different stage in my life. But those were two things that really stuck out. I think, there wasn't a lot of information being published at the time, when this was being, when we were looking into this topic, but now kind of looking at different publications that are coming out about, stress affecting different populations differently during the pandemic. It kind of aligns with what we're seeing. So it was more of a confirming experience. But those are two things that I did find a little bit more concerning or surprising than I was expecting. Do you want anything to add, Tara?
Sure, yeah. So, I didn't attend all of the sharing circles. I attended a select number of them. So, of the ones that I attended, and then also when I would speak with my colleagues who did provided the mental health support for the others, some of the other work. Métis folks, and again, Sarah spoke to this, in terms of underfunding of mental health services for Métis people, for Indigenous people, but particularly for Métis people. Which is a chronic, long-standing issue that needs to be corrected. A lot of the time, folks use those spaces when we have a topic of mental health and we have a sharing circle space for people to come forward. What can happen is that, citizens end up using the space to actually process sometimes their own experiences of mental health. So we didn't necessarily ask, it can very quickly, if the facilitator is not sort of exercising some control in moments, can very almost quickly shift into a bit of a therapy space where we start to have people talk about personal lived experiences that are very, very difficult. And so I think we saw that sometimes where, because there is just such a lack of other opportunity for Métis citizens to access spaces to talk about mental health or to work on their own healing and wellness and their journey, that these research spaces then start to shift into that realm, right? Because this is an opportunity where I'm with community, I'm with people who have similar lived experience, and so I'm going to start to share my personal story. So I wasn't surprised by that, but I think it just speaks to the need for long-term sustainable funding for mental health services. There are systemic issues and barriers that Métis people face. They do not have access to non-insured health benefits for mental health services. These are things that have to be addressed to create equity, to address an inequity that has existed for a very long time around mental health care for Métis people. So I'll stop there. You're getting me fired up with these questions. I love them.
I'm going to add on to that, though.
Go, Abby. Go.
Yeah, please.
Yeah, so we ended up having a number of sharing circles happen prior to starting the interviews. And before that, it was just going to be the interviewer and the participant. But having been able to read the transcripts that were coming out of the sharing circles, I was very adamant about having a psychotherapist present because there were some really heavy topics and very personal stories that were being shared. And myself not being a clinical mental health professional, I really felt that I needed the support to be able to have these conversations with folks, to be able to, have someone in the room who has that clinical lens and has that training to be able to support them if they start getting into more personal stories. Not that we were encouraging it necessarily, but just because sometimes it did take that route. And so to allow that person to have the space to say what they need to say without getting turning it into a therapy session, because that's not what it was meant to be. But yeah, so that was, we actually ended up going back to ethics to be able to have psychotherapists present. And that I found was very helpful for myself, and I think was something very much appreciated by participants.
Thanks so much. It's a complex space to be in, right? When people are sharing and how to manage that. So I have a question that came up, and it relates to older MNO citizens that I think you talked about seeing some unexpected high rates. So it says, I wonder if the unexpected increase in outpatient rates of older MNO citizens may highlight a technical barrier with less comfort with online. Interesting.
Actually, yes. I mean, and I do believe, it was so obvious that we haven't presented it, but we were able to capture the virtual visits. And of course, there was an increase there. So some of these visits, in fact, that we're counting would have been virtual visits, but that could be something that we could further explore or tease out in the future.
Thanks, Sarah. And that was another question about whether you could differentiate virtual visits from the in-person. So that's helpful that you were. One person said the presentation's frozen for them, but hopefully others are able to see it. So there's another question around the expected line. So it's also interesting that the expected line for mental health and addiction outpatient visits looks relatively stable pre and into pandemic times. I understand it, but would also expect that the expected line would have gone up given we were in a pandemic. So they were just wondering if you had any thoughts on that.
I mean, I think the expected line is basically projected out from what we observed in the pre-pandemic period. So if the pandemic had not happened, that's what we would expect. So I think that's why it's very consistent. And so the rise we see is in the actual observed, right? But you'll notice the pre, we can see that the expected and the observed are both on the same, pathway, but it deviates post-pandemic. So what that commenter had expected is exactly what we saw, right? And what we had hypothesized too as part of this study.
Another question relates to something you shared, or we talked about a little bit earlier around limitations, in particular related to administrative data, and it needs to be publicly funded for the data that we have at ICS at least. So they were wondering if there's thoughts for bringing in some of the care that are accessed through MNO services, given that Métis citizens are accessing mental health services there, into this project to be able to get a more complete picture.
Yes, the Mental Health and Addictions program at the MNO is quite interested in bringing the data over. They do track and monitor that internally. They have an internal administrative data system called OHATS. And please don't ask me what the acronym stands for, but that all those visits are tracked. And so it is in the queue as one of our projects to be able to bring that data in and explore that data in a more longitudinal way, because right now the tracking is very cross-sectional. Like at this point in time, this is the number of clients we're serving, and this is what their needs are. And so we'll be able to link some of that over time, because the MNO has quite a comprehensive plan in terms of tracking where citizens are when they are taken into the program, and throughout the program at different periods, and as they exit the program. There is a tool that is used to track that. So we would be able to link that together with the analytic skills and infrastructure here at ICES that is not possible in the OHAT system, just as a function of that system presenting data. So yes, it's in the queue. we have a number of projects on the go. So yes, and it does take time to bring data into ICES. So we're working on it.
I think those were all our questions so far. So any final thoughts from the panelists?
I guess I could.
Oh, go ahead, Abby.
Sorry.
Go ahead.
Sorry, I should have directed that.
Yeah, no, it's okay. I guess, yeah, it was a really, for me, I guess just some reflections on working with the project. It's one of the projects where we, I think, had the most Métis collaborators on, which was really fantastic. So it's been awesome being able to work with Tara and Benny and the psychotherapists, Riley and Shane, to be able to talk about and process at least for me, the qualitative data, to be able to have kind of more Métis minds thinking about it and being able to come up with really well considered interpretation. So those are my reflections for the portion of the project I was most heavily involved in.
Tara?
Yeah, I was just going to say, I think it's important to acknowledge ICES for creating these opportunities for amazing folks like Sarah and Abigail to come over and work with the Métis Nation of Ontario. These partnerships are really important to support the work and to bring in, especially Abby, who's Métis and Métis epidemiologist. And it's really phenomenal to be able to have our own people help steer and guide this work, and, very much holds it holds up the value of self-determination around data governance and data governance, but to have our own people be able to do this work with the support of phenomenal folks like Sarah, who very much, I understand in the role of an ally and is very willing and humble to receive direction. And so, for any other folks online who are working in projects, I suggest, not that Sarah has any spare time, but, to really connect and talk about how do you work in a good way with Indigenous communities, and especially the Métis community. I hope ICS continues to prioritize, the work with the Métis Nation of Ontario, so that we can continue to do this really important work that's not being done anywhere else. So those are just some of my reflections as well on the good work that this project has brought about. Merci.
Thanks. Sarah?
I'll just mention that all of this work is possible because the MNO Secretariat and because elected officials like President Crow are supportive of data and using data to inform decision making and actually understanding the needs and health outcomes and aspirations of Métis citizens. And so it's really refreshing to work in an organization like that. And I mean, I've come from public health and we use data all the time, but in various different ways, it does and doesn't inform decision making. And so I've seen really the lived values within the MNO senior leadership and elected officials to genuinely explore the data and support the use of data and gathering of data in various different ways. So we are using the quantitative data for sure, but also Métis methodologies and truly investing in that. So it's been wonderful to work in that space.
Thanks so much, Sarah. And I have to say thank you to all three of you. I know this is just one project of many that MNO is doing with ICS's support. And I reflect back since the agreement was signed in 2016 and how much the work has grown in the 8 years. It's truly incredible. And this is such a great example of where, mixed methods are being used to support Métis-driven research. So thank you all so much. And thank you to our audience. And we will see some of you at the next session. Thank you.